Mr. S, a noted bus driver of a bus for people with disability, present to his primary care provider with lower urinary tract symptoms. Mr. S is a 71-year-old male, enters his primary care provider's clinic.
Good morning, Mr. S. What brings you in today and what can I do for you today?
But I have been extremely bothered over the last few months with the need to urinate every half hour to hour.
The provider feels that Mr. S may be suffering from benign prostatic hyperplasia.
Mr. S, do you have a weak stream? And does your urination have intermittent flow? Do you strain to urinate? And do you have incomplete emptying of your bladder? How about frequency of your urination? Do you have urgency to urinate? And do you get up at night to urinate?
Well, yes, my urination has weak stream and intermittent flow. I do strain to urinate and I feel that I do not completely empty my bladder. I urinate more frequent than I used to do before, and the urgency are more often. I get up every night to go to the bathroom to urinate.
Mr. S, with the symptoms you had verbalized, you are likely suffering from benign prostatic hyperplasia or BPH.
The provider asks Mr. S further questions to learn more about his urinary status and to rule out other causes of his urinary symptoms.
Does anything, including over the counter medications, make your urinary symptoms better or worse? Mr. S, did you ever have an episode of urinary retention? And did you have any pain while urinating, or did you have a history of urinary tract infection? Do you have diabetes or other neurologic disorders which can result in bladder dysfunction? Do you have any history of urethral strictures or sexually transmitted diseases? Mr. S, do you have any previous endoscopy or surgery of the urinary tract?
But I am not aware of any other condition that I may have. I am currently not taking any medication.
The provider is now doing the physical exam on Mr. S.
Based on my findings, Mr. S has no costovertebral angle tenderness and his bladder does not feel distended on palpation. His genital examination is normal and the digital rectal examination reveals a prostate which is 4 centimeter in breadth, smooth, and non-tender. On neurologic exam, Mr. S. anal sphincter tone and perineal sensation is normal and his sacral reflexes are intact. Mr. S., we need you to complete a validated questionnaire called the International Prostate Symptom Score or IPSS. This questionnaire documents the baseline severity of your lower urinary tract infection symptoms, and this can be used to monitor the impact of therapy. I will have also you do a test called urinalysis to test or rule out infection, assess for hematuria or blood in your urine. We may also need you to have a voiding diary that records the volume and the timing of oral fluid intake and urination. I will also need you to void now and then you come back and we will put a urinary catheter upon completion of your voiding to measure the post-voiding residue. There are other tests that can be done to confirm benign prostatic hyperplasia, and these are uroflowmetry or measurement of the urine flow rate, urodynamic testing, which is a cystometry, pressure flow analysis, and this is done by a urologist.
Mr. S completes the International Prostate Symptom Score or IPSS questionnaire, which documents his moderate to severe urinary symptoms.
Your IPSS questionnaire, it shows document of your moderate to severe urinary symptoms. We have your urinalysis result and it shows no evidence of infection or hematuria. Your post-void residual urine is low.
Okay, I understand. So, what will be the treatment of my symptoms?
You don't need a urodynamic evaluation now. I will start you first with the first-line medical therapy for benign prostatic hyperplasia. The medication is called terazosin or Hytrim. It is an alpha blocker and its action is to relax the prostatic smooth muscle, and this will eventually facilitate the opening of the prostatic urethra. We will start you on 2 milligrams by mouth at bedtime and over the next few weeks, and we will slowly increase the dose to 8 to 10 milligrams by mouth at bedtime. Mr. S, you must watch for the side effect of this medication, and the most common side effect is dizziness. If this occurs, you must stop the medication. Other potential side effects are headache, fatigue, and nausea. If the medical therapy will fail, the next option will be surgical treatment.
Okay, I understand all that you told me.
Mr. S, I will give you some patient education or instruction when you go out, and your appointment to return to my clinic in 4 weeks. Thank you, Mr. S, and I will see you back in your next appointment.